Hi and welcome back to our page. Today I want to share some very important news about home care in England. Recent reports have revealed that around 60% of home care services have either never been inspected or have not been inspected in the last 4 years. This means thousands of providers are operating with no up-to-date rating. In this video, I will explain what this means, why it happens, what the Care Quality Commission is now doing about it, and most importantly, how you can make sure your service is ready. First, let's start with the facts. Analysis published in late 2024 showed that about 23% of domiciliary care agencies have never been rated by CQC. These are services that registered but not have yet had their first inspections. Another 37% have not been inspected for between 4 and 8 years. When you add these two groups together, that is 60% of all domiciliary care services in England with no inspection history or a very outdated one. This is a real concern because people using these services and local authorities commissioning them are making decisions based on ratings that don't currently reflect their standards. A provider that has improved might still carry a low rating, another that has declined may be still listed as good. So, why is this happening, you may ask? Well, firstly, the number of home care providers has grown rapidly in the last 10 years, and CQC has struggled to keep up with the inspection workload. Secondly, CQC itself has faced challenges. An external review found weaknesses in its IT systems, staffing levels, and leadership. And at times, this means inspectors were not able to complete enough visits to keep the ratings up to date. And thirdly, the pandemic created delays across the whole sector. During COVID, many inspections were paused or carried out remotely. This has left a backlog that CQC is still working through. In response to these problems, the CQC has made a public commitment to increase inspections. Between April 2025 and September 2026, CQC has set out a target to carry out at least 9,000 assessments across all sectors, including adult social care, home care, hospitals, primary care, and mental health. By August 2025, they have already completed more than 2,000 assessments, showing they're moving in the right direction. So what does this mean for home care providers? Well, this is very important. If you've not been inspected for a long time, there is a high chance you will be inspected in the next year or two. Inspections are also changing, so providers can expect shorter notice periods before an inspection, inspectors asking for evidence quickly, sometimes even before the visit, a greater use of remote methods such as video interviews and digital evidence reviews, and a stronger focus on continuous compliance, not just being ready on the day of inspection. This means providers need to have good systems in place every single day, not just a quick tidy up before an inspection, because CQC are going to go way back. So, this is where we can help. At CareSync Experts, we support providers to prepare for inspections and stay compliant all year round. We do this by carrying out mock inspections so you know exactly what to expect, reviewing and updating your policies, training plans, and records so they are inspection ready, helping your registered manager and leadership team prepare for CQC interviews, and providing a digital compliance system that keeps your evidence, audits, and feedback organised and up to date. So let's recap. At the moment, around 60% of home care providers have not been inspected in at least 4 years, or at all. And that's changing. CQC is now increasing inspections and plans to complete 9,000 by 2026. For providers, this means greater scrutiny and less time to prepare. But it also means an opportunity. If you're well prepared, you can use your next inspection to show the real quality of your service and to build confidence with the public and commissioners. And at CareSync Experts, we can help you turn that opportunity into success. Thank you so much for watching. Make sure you like, follow, subscribe, and share this video.